I'm Dr. Craig Alter. I'm one of the senior clinical pediatric endocrinologists at the Children's Hospital of Philadelphia, which is part of the University of Pennsylvania. My background is a pediatric endocrinologist, which means that I went to college for 4 years, which I did at UPenn. Then I did 4 years at Harvard Medical School with a joint program with MIT. And then I did 3 years of pediatric residency that was at Boston Children's Hospital. After that, to become an endocrinologist, I did fellowship training, which I did at the Children's Hospital of Philadelphia, where I currently work. Well, I feel like when we see families, they have a lot of questions, and some of them go beyond just endocrinology. They have a lot of school questions, they want to share a lot about their lives. And I realized that the best way to do that is not just to share it with me, but to share it with other families who are in similar situations. I find that no two families are the same, that every family has unique issues. At the same time, they do share a lot in common. And what better thing is it for a family to see that, wait, they have the same thing too, it's not just me. I think that's just a great experience. I know a lot of time when people see their endocrinologist, they go over laboratory studies, they look at the growth charts, the endocrinologist discusses changes in medication, but there's often not time for the families to get an overview of what really happens in the pituitary gland, what's missing, what's not missing. So I think this is a good opportunity to get the basics of what happens in the pituitary. At the same time, it's a great opportunity to ask more complicated questions about either diabetes insipidus, or about school, or about interacting with other kids in society. It's really just a great opportunity to get a lot of information about whatever your child has in the neuroendocrine system. You may have had this condition for many years, but it's not like you went to a course on what is involved within the pituitary gland. I think it's a great opportunity for you to ask questions that you maybe never asked your provider. A little secret is that I learned a tremendous amount from these conferences. When families tell me that they're having issues with something, I don't always know that. And it could be something financial, it could be something about school, it could be something about work. So I'm learning a tremendous amount, not just from my own families who attend the conference, but from everyone else. So I'm a learner as well. For a conference that's family-centered, you get some families that raise their hand sort of every 5 minutes, and other families that stay quiet. Don't be intimidated by that. There are also more quiet ways to ask questions. You could approach the speakers separately. This, of course, is going to be virtual this year, but there are a lot of opportunities for you to get your questions raised. And please don't be shy, because there's no such thing as a bad question. If you have a question, there's a high likelihood that someone else is thinking, I was thinking the same thing, not just the person who's raising their hand all the time. This is an opportunity to be creative. There's an opportunity to write questions rather than just pose them verbally. Some people would never ask a question verbally unless they're the only person left on the planet. But in the virtual scenario, you'll be able to write some things down, submit questions. I don't know fully the format that it's how it's going to work, but we're going to all learn from this. This is a new powerful system, and you don't have to travel.